Great day, everyone. Welcome. Thank you for watching Liberate Yourself from Chronic Pain with yours truly, Stephen Simon. Today, I'm going to be speaking about medication and your mind, right? And, the mind is very powerful. It has, it can really trick the body. And we're going to talk a little bit about that today. So, I hope everyone's feeling great, feeling healthy, and the subject is a little bit can be complicated, but I'm gonna make it simple for everyone to understand, hopefully. Okay, so let's get started. Now, when we take medication affects our bodies in two different ways, right? So the first way is determined by the nature of the chemical of the medication that you're taking. And the second is actually triggered by your beliefs and your expectation for that medication, right? Our beliefs and our confidence can actually change the body chemistry and even our symptoms as well, right? So this reaction is called the placebo effect. Okay, if you're familiar with what a placebo is, I'll explain that in a moment. So, the placebo effect is basically an example of how closely the mind and the body are connected, right? So it's the power of the mind over the body. So when people are given a placebo, now a placebo is a pill that doesn't contain any medication, right? So you are, let's say you have a headache or something and you're taking a pill, although there's no real medication in there, it cures you, your headache goes away even though there's no medication in it. But why is that, right? Let's keep going and I'll tell you. But so doctors are known to give placebos for symptoms such as headaches, as I said, arthritis, back pain, allergies, asthma, even depression, anxiety, and yes, even chronic pain. Um, you know, the effect doesn't last long, indefinitely, but it does last for some time, long enough for you to get some relief, you could say. Now, so the placebo effect clearly demonstrates that, when we have positive beliefs and expectations for taking that medication, it can activate our self-healing mechanisms within the mind, right? And in a way, we kind of learn to use and take advantage of a powerful, like, internal pharmacy that we have in our brain. So, and it's just activated by our expectations and our beliefs, basically. So, now every time you take medication, you're basically swallowing your expectation and your belief for that pill that you're taking. As I said, I use the example for a headache. When you're taking a Tylenol or an Advil for a headache, you have the belief or the expectation that your headache is going to go away. And doctors will prescribe you a placebo for whatever, some of those symptoms that I just mentioned, even though there's no real medication in it, but still your headache, you get some relief from it, right? So it just goes to show you that how powerful the mind is. And when you have expectations for taking a pill, you might as well have like the best expectation, meaning that it's going to help you, right? Now, let's examine like some of our beliefs about the treatment that we take, right? So, for example, let's say that you believe that, you're not a pill taker, or that, medications give you, a bad side effect or something like that. In a way, when you do that, your body also, responds negatively. It responds like it's not going to help, because that's your belief, that's your expectation for that medication, right? So if you doubt that the prescribed treatment is likely to help your symptom or your condition, then that negative attitude undermines the ability of the pill to help you. And you change these if you change these negative images into positive ones, then they are more likely to help you. Okay, so think of your medications the way that you think of vitamins, right? When many people associate vitamins, they usually have a positive outlook, a positive image with vitamins, right? People that take vitamins think that they're doing something positive, either to prevent disease or promote good health. And if you regard your medication as aids to restore and promote health, like vitamins, you may obtain a more powerful benefit from your medication. All right. Now, imagine how the medication is helping you, right? You just imagine how the medication is helping you. So, develop a mental image, okay? Develop a mental image of how the medication is helping your body. For example, if you're taking a medication, tell yourself that the medication is finding its way through our central nervous system and closing the pain gate. Okay? So for some people, forming a vivid physical image is actually helpful. Now, in a way, an antibiotic, for example, can almost be seen like as a broom, sweeping germs out of the body, right? So don't worry whether your image is like medically correct. It's more about your belief in a clear, positive image that counts. All right. Now I'm going to give you an example. A little story is that when I go into emergency, and when you're in emergency, I either get the beef. When you go into triage, right? You go into emergency and you see a doctor, they put you into triage. And for me and my situation, they will give me either, morphine they'll ask me, do I want morphine in the form of a pill or morphine through the intravenous? And when I'll ask for the intravenous, because it goes directly into the bloodstream, and it gives me relief a lot faster than the pill waiting to dissolve and then activate, right? It might take 20 to 30 minutes before it's activated. But as I get the intravenous, and although it hits the bloodstream instantly, my mind is also telling me that, just as they're pressing down, even, my mind is telling me I'm getting relief. It could even be before they actually push the syringe down. I'm already settling, my mind and my body is already settling and preparing to be in relief before they even have done it, because I have that image, that positive image of relief and belief, expectation that that medication is going to work and give me relief. Okay, so um, some of you may be able to relate to that. You may have had the same experience in Emerge, in triage, and you kind of know what I'm referring to. Okay, now also you want to keep in mind why you're taking the medication that you're taking. Okay, so you're not just taking your medication just because your healthcare provider, told you that you have to take this medication to help you live your life. But, it's also important to understand how the medication is helping you. Like, you use this information to help the medication do its job. Okay? So, here's an example. Okay? Suppose a man with lower back pain is given an antidepressant, right? So, the medication is to improve his back pain and his mood. He's been told that, the medication will make him feel drowsy and dizzy, and it'll cause him to have a very dry mouth, like thirsty, so dehydration kind of thing. So of course, that's what he's thinking about. He's thinking that he's gonna be drowsy and dizzy and he's gonna have a dry mouth. That's already in his expectation, so of course, because that's what he's thinking about, that is what happens, right? But suppose you also tell him that he's told that the symptoms will only be temporary, and that in the meantime the drug is building up a therapeutic level in his body, right? In a few weeks he'll start to believe that that experience, and it's improving his pain and his mood, because that's what his expectation is. So these side effects indicate that the drug is starting to work, and then he takes the actions that counter those type of effects, that and often he has an easier time kind of tolerating those symptoms as well. Okay, does that make sense? So in a way, it's kind of like I said, your expectation and your belief about the medication. And as I said, it's doctors are known to prescribe placebos to people. Like, it's just and to those people, the medication is working even though there's no medication in them. So when you are taking medication, just have a positive outlook on the medication that you're taking, and hopefully just believe that it's helping you, and know why you're taking the medication, what it's actually doing to your body, or in your body as well, right? Sometimes it takes time for it to build up, as I said. So not all medications will have an immediate impact or relief on you, but it's just, you have to know like what's actually happening inside of your body when you're taking these medications. So I hope this video was valuable to you guys, and hit the like and share button. And if you're watching this on YouTube, then feel free to subscribe to the channel, and I look forward to providing some more valuable info for you guys. So I hope this helps, and that you are now liberated and from chronic pain. Okay, have a great day, and talk to you soon. Okay, take care.